A lot of times patients come to the office and they can just write a check for the procedure, but that's not everybody. In fact, most people are financing all or part of the procedure. So what does it take to be approved to finance this? If you have a 650 credit score, if you have good income and a good debt to income ratio, we have an option to help get you financed. Now we have financing options with payments starting in the $450 range, all the way up to the maybe $900 range, just depending on what each patient needs, their financial situation. So I don't want anybody to ever get hung up on, hey, I can't afford this right now, I don't have the money for it. All of these options we offer, all the financing plans, they don't have a prepayment penalty. You can pay it off whenever you want. In fact, I had a guy the other day that could write a check for it. He financed it for 3.9%. And he said, listen, that's lower than what I'm making on my investments. It's way smarter for me to borrow the money from this lending company and just pay it off if I feel like paying it off. So if you have a 650 minimum credit score, if you have a good job, you've got good debt to income ratio, we're going to have an option for you. So what happens if you don't meet those minimum criteria? It doesn't mean it's a no. We have lots of patients can get a cosigner. In fact, the way this works is anybody can cosign for you. They can put it in their name. They don't even have to be the person getting the treatment. So if you have a parent or a really good friend or a spouse that can help you, that's an option. The bottom line is, if you know that you need something done, if you're ready to move forward and change your life, we most likely have a solution to help you.